Hello, everyone. Uh, a total change of scope since I'm not a meteorologist myself. I'm a PhD student at the Computational Biology and Complex Systems group in the Universitat Politècnica de Catalonia. And today I'm going to talk to you about the research on the association of temperature and absolute humidity with the influenza illness in Catalonia. So first of all, well, this is the layout of the presentation, and what's the influenza disease? I'm sure every one of you knows it's the flu, right? And in Catalonia, we have two main strains, A and B, which have some difference in severity and also epidemiological dynamics, but they are neglectable for what we're going to talk about. And also vaccination for the flu is available, but the viruses are constantly mutating, so each new vaccine is made using the knowledge of the strain of last year, so they might not be as effective as other approaches. And also Catalonia, so we are here right now in an autonomous community in Spain of approximately 8 million inhabitants. You are in the city of Barcelona, which is 1.1.6 million inhabitants. So those numbers are for you just to realize that when we say that 5 to 20% of the population gets the influenza, gets the flu every year, we're talking about large numbers, which cause saturation to the healthcare system seasonally in winter, because we're on the northern hemisphere with temperate climate. So in this slide, you can see on the x-axis days, left axis incidence of disease, and right axis the climate variables referred to. So the green bars are the influenza incidence, and the red dashed line temperature, and blue dot line absolute humidity. You can see that before the COVID-19 pandemic, we used to have a very clear seasonality of the influenza disease, but then COVID-19 changed everything, and we are slowly recovering the previous dynamics. And there seems to be, if we are only looking at this slide, there seems to be an inversely proportional relationship between those climatic variables and the influenza season. So we actually know that the environment is a determinant on the transmissivity of viruses, as well as the characteristics of the virus and also the characteristics of the host. So if the virus has the viral envelope, it reacts differently to the environmental conditions. And the host also can have a diversity of lung function, anatomy, etc. But what you may be more interested on would be the environmental factors. So we know that influenza likes a dry and cold climate with neutral to low pH, also a poorly ventilated climate so that aerosol particles can be accumulated, and low exposure to ultraviolet radiation, and it does not really discriminate between fabric and non-fabric surfaces. So yeah, with all this knowledge, we wanted to define the relationship between influenza's transmissivity and climatic factors such as temperature and absolute humidity due to the large state-of-the-art knowledge about that, and also because those are the climatic factors that we have available. So yeah, and we want to model and predict the influenza epidemic using information of these climatic variables. So we have three main data sources. The first one is the surveillance system of Catalonia in viral respiratory infections, which is CIVIC, and we downloaded from there daily historical data on clinical diagnosis of influenza in Barcelona. Those data sets are open access, so everyone can dig into them. And we also use daily historical data on temperature and relative humidity that we converted to absolute humidity from the meteorological system of Catalonia. And finally, to compute the incidence of disease, so the population of the city of Barcelona yearly, thanks to the city council. So the project that I'm going to talk to you about, I don't know if I can stop this presentation thing, but it's okay, we'll just go back. So this is based on a baccalaureate project from one of my students, Mario Bravo Masferrer, And we developed a SAIR model for the influenza epidemic. So what is a SAIR model? We just divide the population into boxes. And there's one box for susceptible people to the infection, and there's one box for those people that are exposed to the infection, and there's another one for those people that are already infected, and another one for the recovered people from the disease, right? And you can go from one box to another one using, through a certain parameter in a certain tax, a certain velocity. And those parameters are from susceptible to exposed, the transmissivity of the disease, which is the parameter in which we are interested in, because this is the one that we can relate to those somatic factors, so how the disease is transmitted. Then we also have from exposed to infected, a parameter related to the incubation period, and from infected to recovered, a parameter related to the mean infectious period. So this model, whose equations you can see on the screen, and it's just, so how do we work with this model? It's just we adjust those equations to the observed data of clinical. So the epidemic wave that you saw in the beginning is modeled by the infectious equation here displayed, and we just adapted firstly this SAIR model to the influenza epidemics. You can see the different seasons here, using a 3 steps alpha approach, which is, I don't know if this will work. Okay, no. So if you look closely to the different seasons, you will see that there's a change in the slope of the epidemic every year, and there are 2 changes of slope. So it first grows like this, then like this, then like this, no? So we have 2 changes, and that is described by the 3 steps function of alpha, of the transmissivity. So adjusting this model for every single season, pre-pandemic season, you see that it is adapted very well and accurately models the season, except for 2023-2024. So this year cannot be reproduced with this model. But if you, so the same as you want to tell the people to be aware of the heat of next week, right? We want to tell people to be aware of the cases of next week, right? And we want to prevent people from massive gatherings, etc. So we are interested in predictions, and if we need to adjust a model to every single season, those predictions are delayed in time because we need more data to train our models. Then what we intend to do is to have a single model that can be used for all seasons. Spoiler. So this model that can be used for all seasons, using this same approach, cannot reproduce accurately all the influenza epidemics here in Catalonia. So you see, there's a huge difference in some seasons, and still does not work well with the 2023-2024 season. Okay, so this is non-meteorology right now, all of you bored right now. Then let's start with the climatic factors. What we thought, and what Mario actually implemented previously, although in a seasonal, in a weekly manner, and I'm going to present to you the daily results. So we thought, okay, so there are 2 changes of slope in the influenza epidemic, and those are related to a certain level of infected people. So when we have those changes so we have 3 different values for the transmissivity, right? Actually using those values, so every season that adjusts to every season perfectly. So using those different values of alpha throughout the epidemic wave, and looking at what temperature there was. Oh, okay, this is hard to explain. So we want to look at what temperature there was when we change to each transmissivity value, but not the day of the change, but 14 days before the change. Because we actually observed correlation between the initial cases of the epidemic with 2 weeks prior to with the temperature 2 weeks prior to the start of the epidemic. And that makes sense to us because then you have this delay of the virus infects the person, then the person starts to produce symptoms, and then they go to the hospital or the provider healthcare and everything. So with that, we achieved to have an explicit relationship between the transmissivity, which is this alpha, and the temperature on the left and the absolute humidity on the right as an exponential fit. And we used it to do our models again. What do we find? So now we are using a single model for all the seasons. And as you can see, we actually reproduce quite accurately all seasons magnitude and with a small error, the peak day. But also now season 2023-2024 is well described. So we have achieved to have a single model for all epidemic seasons that works well, and we are using temperature there. And for absolute humidity, absolutely the same. There are small changes between one and the other, but actually you can see there that the absolute humidity one kind of represents better the growth of the epidemic from 2023-2024. But yeah, those approaches were working, but we are adjusting here the whole season. And we want to make predictions. Then we did an iterative approach using every time more data from. So we wanted to adjust to the epidemic peak and some days before the epidemic peak, as we want to be able to tell the public health authorities, you should be aware of next week's cases, or the peak is going to be that day, right? So iteratively adjusting the model, we see that the first basic model converges quickly to the day of the peak prediction, although the magnitude is not well described, and okay, this is the temperature one. So this is the temperature model, and it first starts very outside the scopus, but now after 2 weeks before the actual peak, it is able to provide a good prediction of the peak magnitude and also the peak day with more or less 5 days of error, which is not that much because usually public health providers only mind the week of the peak, not the day of the peak. So 5 days of resolution is quite nice. And with the absolute humidity model, quite the same. Although this one looks a little bit more robust than the temperature one. So after this, as a summary of the different models, the basic model without any climatic factor predicts is adjusted to to every year's epidemic accurately, and gets the day of the peak with a smaller margin of error, but we cannot adjust it to the season 2023-2024, so it might be less adaptable to changes. But the temperature and the absolute humidity model do allow us to model this last epidemic, which was different from previous ones, and also have a good or a better prediction of the magnitude of the peak than the basic model one. And as the limitations, of course, the main limitation that we have right now with the climate factors models, which we call meteo models. So with those meteo models is that since we're using the temperature and absolute humidity 14 days prior to the day we are at, we cannot do predictions for farther than 14 days, and that's a limitation. So yeah, as a conclusion, the transmissivity of influenza can be modeled using climatic factors, but be careful with this approach and with this interpretation, because there might not be the climatic factors who are leading influenza, but the social behavior related to those climatic factors, which are actually affecting the transmissivity of the disease. So when there's colder weather, we also go more into indoor spaces, and we talk closely to other people, and etc. Right? That's it. Thank you very much.